Perhaps for some of you, the sexual tipping point model may offer some useful reminders. The STP is an easy way to remain mindful of all the mental and physical elements of sexual function and dysfunction. But what really changed the model's acceptance came unexpectedly. When I was explaining it to a multidisciplinary group of experts at Behringer's Neurobiology Advisory Board. Now, Jim Faust, the famous rat researcher, he thought this was hysterical, and he filmed me. But he also included an illustration of the model in his highly cited article, Pathways of Desire. BI had hired a media company to produce images for them, and Shaw Science licensed the model for their film that explained desire. So I donated the rights to the model to a foundation I started in 2011 so that the money accruing from it could be used to encourage young sex therapy researchers. BI left the sexual medicine business, selling fulvestrant to Sprout Pharma, but the film never saw the light of day. Fortunately, friends knowing all this have donated money to this charity, allowing me to present the STP awards like the one being given out later today. In all these cartoons, I use both sliders and dimmers interchangeably to illustrate the variability of sexual response. Each dimmer is a micro-variable switch that symbolizes a factor's varying polarity, with some of them being positive, some negative, some neutral, and of course some are unknown at this time, and I wanted to leave room for future discoveries in the way the model worked. The dimmer size in the mental and physical containers show the magnitude of the factor. The net sum of all these factors determines the STP, shown on the sexual balance scale at any moment in time. When a mental and physical container, and why on both sides? Because sex is always both mental and physical, whether excited or inhibited. It's sort of like a four-way matrix. Excitatory and inhibitory processes can occur simultaneously, and their balance determines the overall sexual response. But changes in polarity and magnitude can be bidirectional. Mentally, a once desired touch can become traumatizing after rape, of course. Feeling great helps, illness inhibits. You're diagnosed with COVID, you don't feel like having sex. Now that's despite the person having the exact same genetics they were born with, so it's not a question in that case of predetermination. Now we know sex drug effects can be bidirectional. Viagra can help excite. High blood pressure medications can inhibit. SSRIs are well known for their inhibition or at least diminished reaction of orgasm, especially in women. And common objects can become fetishes like Mrs. Robinson's stockings in The Graduate. Clearly a movie reference that dates me. This STP cartoon actually depicts a real case. A man was referred to me for ED treatment, secondary to his ex-wife humiliating him. She yelled out in open court during their divorce, "You are the worst lover I ever had." He came to see me 2 years after the incident. The cartoon shows the breakdown of various potential factors I considered related to his chief complaint. The red and blue sliders are numbered and lettered. The M's are the mental factors. The P numbers are the physical factors. Each numbered and colored ball is then placed on the balance beam tray, tilting the sexual tipping point towards sexual excitement or inhibition. I want to pause for a second just so we can read these lists of key factors, or at least some of them are key factors. Clearly thoughts about what happened, his feelings of humiliation. He had confusion regarding interpersonal relations, and he actually tried going out on a date after a couple months and had a sexual experience, but while pleasurable, it was just insufficient to trump the inhibitions he was feeling, and he was unable to perform. Then he'd gone for an unsuccessful psychotherapy. It was a supportive therapy. It helped him feel a little bit better about himself, but nonetheless, no improvement in his erections, perhaps not surprisingly. In terms of physical factors, anatomically, he may have been predisposed. Some people get headaches, some people get stomach aches, some people get sexual problems. Not everybody who hears like a mean, nasty comment about their performance avoids having sex for a couple of years. Unfortunately, he began drinking too much to manage his quote-unquote bad feelings. It turned out he had low testosterone, which we had diagnosed, evaluated, and treated. Genetically, he may have been predisposed. Perhaps some of that predisposition was some neurosensitivity, as we were just talking about before. And importantly, there's unknown factors, but I mean, God knows the above is enough already. He did go to a urologist soon after he had that failing experience with a one woman. And the doctor did give him a PDE5 inhibitor. But unfortunately, there was insufficient dosing guidance. He never went back to that doctor, and that led to more negative self-effacing thoughts. By the way, the and in the center between all those arrows is it reflects the fact that the line between mental and physical is porous. That's what all those little dots are that you see. Thoughts become translated into biochemical, electrical components. Listen, do I really believe or expect anyone else to diagram this out in the sort of obsessive way that I've done here, like some fifth grade English diagnostic English assignment or something? No, of course not. But the cartoon is there to remind us to consider all the multiple potential factors and not just the ones we're comfortable with identifying. Both physician and non-physicians alike are siloed, leading to myopic patient care. For me, at least, keeping all this in the back of my mind helps me keep a more open perspective. As I'm not there to answer Q&A, please allow me to take just another minute to provide some quick take